Hello, and welcome back to the Aced It podcast. This is season 9, of course, where we turn science into sense. In this season, we provide 10 timely episodes with the hopes of helping listeners understand what we can learn from current research on harm reduction. And let me just say, there is so much here to learn. So, I'm glad you're with us. I'm Danielle Rudes, your host, and this is Aced It. Overdose fatality rates in the United States have increased significantly over the last several decades, and many people working in harm reduction spaces are searching for methods to reduce these numbers. One harm reduction program that has shown promise but is very controversial in the U.S. includes supervised injection programs. Supervised injection sites first became popularized in Europe around the late 1980s. The purpose of these sites is to provide individuals who use drugs a safe space where they may use their substances under healthcare supervision. Here, healthcare providers give people who use drugs clean supplies, care in case of an overdose, and referrals to treatment services. It is a harm reduction model that does not require a person to stop their drug use. It just makes drug use safer, reducing the risk of infections and even overdoses. They are legal and pretty widely used in Europe, Canada, and Australia, but not currently in the U.S. In the U.S., the Controlled Substances Act states that it is illegal for a person to maintain a space for purposeful use of illegal drugs. And even though overdose rates are soaring, recent appellate court rulings maintain the illegality of safe injection spaces. In addition, some people hold negative views towards such spaces because they believe it enables people who suffer from substance use problems, that it will lead to more drug use in the communities the sites are in, and that it is illegal use of taxpayer money, as it provides free syringes to individuals. But existing research, which we will review today, shows that supervised injection sites greatly reduce overdoses and have no identifiable effect on crime or drug use in the community. And because overdose rates are so high, previously controversial harm reduction efforts are being considered. The U.S. Department of Health and Human Services, for example, has services for needle exchange programs and provides individuals with fentanyl test strips. Overall, research shows that supervised injection sites are beneficial to both the individual person and the community at large. Levengood and colleagues published an article, Supervised Injection Facilities as Harm Reduction, a systematic review, that reviews existing studies on this topic. Specifically, they conducted a systematic review, which means they chose specific scientific research in the area of supervised injection sites. Once the research is all combined, Levengood and colleagues analyzed it and summarized it into findings to give us a current state of the literature. They were specifically interested to know what research has to say about the influence of safe injection sites on overdose mortality, injection behaviors, access to addiction treatment programs, and crime. Levengood and colleagues included 22 published studies in their systematic review. Most of the studies came from Canada, some from Europe, and some from Australia. When looking at all of the outcome measures together, the 22 studies either found favorable effects or no effects at all. None of the 22 studies found unfavorable results. More specifically, in terms of the results for overdose mortalities, rates declined substantially in areas close to the supervised injection sites, and in one study, there were more overdoses on days when the sites were closed. This provides us with evidence to show that supervised injection sites have the potential to decrease the U.S. skyrocketing overdose fatality rates. Injection behaviors also changed when supervised injection facilities were present. For example, among those people who always use the facilities when using drugs, infections associated with drug use decreased, especially compared to those who visited the facilities less frequently or not at all. Syringe sharing behaviors were also reduced, meaning that people who visited the facility were more likely to use clean syringes during each drug use. In terms of access to addiction treatment programs, people who visited supervised injection sites were more likely to access treatment and access detoxification sites. And crime actually decreased. Let me say it again. Crime actually decreased in the areas where supervised injection sites were located. In addition, residents of these areas saw fewer people injecting and found fewer syringes on the street. Although findings are promising, they are geographically limited to Canada, Europe, and Australia. Drug use behaviors and the associated stigmas are very place-specific, so we can't necessarily assume that what happens abroad will happen in the U.S. as well. While the U.S. Department of Justice does not sanction supervised injection sites, 2 such sites now exist. In New York City, 1 in East Harlem, and 1 in Washington Heights. These sites constitute the first publicly recognized U.S. overdose prevention centers. They opened on November 30th, 2021, in response to the rising overdose fatalities in New York City. Both sites are operated by On Point NYC, which is a harm reduction service that provides not only these 2 overdose prevention centers, but also case management services, clinical care, fentanyl test strips, and even a garden in East Harlem for holistic services, shared meals, and ceremonies. Haro Kopas and colleagues evaluated the effectiveness of these 2 sites and published their results in 2022 in a study titled First 2 Months of Operation at First Publicly Recognized Overdose Prevention Centers in the U.S. The researchers worked alongside staff who worked at the overdose prevention centers in New York City, who in turn gathered data from people who visited the centers. The staff collected data when people first got to the center, at intake, and again at each additional visit. Since these sites are relatively new, the researchers provide us with some basic information about effectiveness. But because of this simplicity, we should interpret these results with a little bit of caution. The researchers looked at the first 2 months of operation and found that 613 people used the site during this time and visited the site a total of nearly 6,000 times. In other words, an average person visited the site about 10 times during a 2-month period. As a side note, in terms of some more recent numbers, as of June 2024, over 5,000 people have used the overdose prevention sites, a total of over 145,000 times. The people who visited the site during the 2-month study period mostly identified as male, and about half were Hispanic or Latino and in their early 40s. A third reported being homeless. The most common drug of choice was heroin or fentanyl, and most people injected the drug. If the site did not exist, most people said they would have injected in a public or semi-public space. During these first 2 months of operation and nearly 6,000 instances of drug use on site, staff mitigated overdose risk 125 times. And, by the way, On Point New York City has prevented roughly 1,559 overdoses between November 2021 and June 2024. Oh my goodness. Mitigating overdose risk includes methods such as administering naloxone, oxygen, hydration, and cooling. Notably, during the 2-month study period, not a single fatal overdose occurred. The people who used this site also received additional support. More than half were given naloxone to take home, receive counseling, medical care, or other holistic services. As a whole, this study provides an optimistic, I'd say so, look at the future of supervised injection sites in the U.S. A reduction in overdose fatalities is something that we are all striving toward, and this study gives us evidence that safe injection facilities may be, in fact, they sound like they are, an avenue worth pursuing. However, Nonprofit organizations that try to open safe injection sites in the U.S. still face incredible barriers. For example, a Philadelphia-based nonprofit organization, Safe House, has for years been attempting to open safe injection sites in the city. But it was dealt a blow in April 2024 when a U.S. District Court judge dismissed a case Safe House was filing against the U.S. Department of Justice. Proponents of harm reduction services have in turn devised new services that can help individuals use drugs on their own. For example, new overdose prevention technology has been developed and is starting to gain traction. This includes new technology like wearable naloxone auto-injectors. These wearable injectors measure respiratory patterns and can recognize when naloxone may be necessary. It also includes hotline services and apps like the app Never Use Alone service and the Brave app. Never Use Alone is a toll-free overdose prevention, detection, life-saving crisis response, and medical intervention service. Here, individuals who are alone and who choose to use drugs are able to be on the phone with a volunteer who monitors their use for potential signs of overdose. Once a person calls the hotline, they are asked to provide their name, a contact number, their location, and their substance of choice. The volunteers who run Never Use Alone will then remain on the phone while the person uses for at least 10 minutes. If there is a period of non-responsiveness, the volunteer then contacts EMS so that medical help can be provided. Similarly, the Brave app allows individuals who use drugs while alone to write out a rescue plan through the app and call for support while using it. The rescue plan includes how a person can enter the area where the person is using, allows for emergency contacts, and a supporter will stay on the line while a person is using until they are safe or get help. There are also non-hotline programs and apps like the Canary app and the iKeeper app. Both apps allow users to set up monitoring that will notify a set contact if the user becomes unresponsive. For example, a person can start the app when they plan on using, and if the app senses prolonged inactivity, it can automatically notify the set contact. This kind of service does not necessarily involve EMS services or an unknown volunteer. In conclusion, safe injection sites provide one harm reduction program that shows great promise abroad and in 2 spaces in New York City, but has yet to be adopted in any meaningful capacity elsewhere in the U.S. Overdose fatality rates in the U.S., however, continue to increase, and it may potentially be time to revisit policies and laws that prohibit safe injection sites. In the meantime, it is important for people who use drugs and people who provide support to people who use drugs that they both be aware that these new technology improvements exist and there are phone apps that can help reduce the risk of overdose. Let's do everything we can to help keep everyone alive. Thank you for listening to the Aced It podcast. We love hearing from you. So if you have comments, topics to suggest, or some science you'd like us to cover in a future season, please write to me, Danielle Rudes at Sam Houston State University. My email is drudes@shsu.edu. And of course, thank you to the Justice Community Opioid Innovation Network, or JCOIN's Coordination and Translation Center, funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous scriptwriters, Dr. Alyssa Toman from Texas State University and Sam Houston State University doctoral student Caitlin Bauer. And a huge and heartfelt thank you to Jason Luchin and the team at Slonky LLC for their spectacular production. Tune in again soon for another episode of Aced It.